Together we achieve victory over heart failure.
Hello and namaste. I am Dr. Sudhanshu Mahajan, and today we will be delving into a silent epidemic that India is combating by the name of heart failure. So I would talk about 5 insights of heart failure. In India, the majority of patients grappling with heart failure are surprisingly very young individuals. It is a common occurrence to witness young adults seeking medical attention for heart failure, unlike the Western countries where heart failure is predominantly a disease of elderly. So we should know what are the 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it is the end of their lives. The term heart failure seems very frightening, but it simply means that our heart is struggling to pump the blood as effectively as it should. The ejection fraction measures how well your heart is pumping blood. It is the amount of blood pumped out of your heart's lower chamber each time it contracts. Normal ejection fraction is around 50 to 70%, but in individuals with heart failure, it typically is 30% or lower. Secondly, why are so many Indians affected by heart failure? Genetics. Genetics plays a very significant role in this. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking worsens this epidemic. Moving on, what are the signs and symptoms of heart failure? We have to really be watchful for the confusion, fatigue, palpitation, nausea, shortness of breath, weakness, and also a loss of appetite and vomiting, which could be signs and symptoms of heart failure. How can we protect ourselves from this disease? There are 5 golden rules which we can follow to the return the favor. One is early detection of heart failure through regular blood test. Second is dietary adjustments to maintain your heart health. Third is incorporating daily exercises into our routine. Fourth is practicing stress management techniques. And obviously quitting alcohol, tobacco, and smoking. So we come lastly, what comes next after heart failure diagnosis? Thankfully, medical science has reached great limits. It is possible to lead an enjoyable life even after you are diagnosed with heart failure. There are some medications which improve the quality of life and longevity. There are some devices which are implanted like biventricular pacemakers, ICDs, and heart valve repairs or replacements are done. And a last resort treatment option is heart transplant. The lifetime risk for congestive heart failure is 1 in 5 for both men and women. But you have to remember that awareness and proactive measures are key in combating this silent epidemic. Thank you.